Well, good morning, all. Thank you so much for joining. This is the first of the public meetings with the Resilient 305 Climate and Heat Health Task Force, co-chaired by Dr. Cheryl Holder, who has joined. You can wave to the group there, Cheryl, and Dr. Holder. And we have a 15-member committee that is going to be gathering and listening to your input today and contributing today as well. And this will result in May of a regional action plan to address heat health, particularly as the risks are increasing due to climate change and development patterns. It's being hosted by the Miami Foundation on behalf of the Resilient 305 Collaborative, which is a collaborative between the county, City of Miami Beach, and really all the municipalities, as well as the Miami Foundation. And it will be an action plan that will include lead actions from all different sectors of our region. So today, I'm going to just do a quick overview so that we're kind of starting off on a similar page in terms of understanding current and future risks related to extreme heat. What are a review of some of the current actions that we've been taking, best practices, research nationally, and then what we're thinking about just very broadly in terms of heat season campaign. Then we'll divide up into 4 breakout groups. You'll be pre-assigned. Everyone's going to be talking about the same thing, so it doesn't matter which one. It's really just to give smaller groups so that we can get as much input from all of you. And we'll be gathering answers to some questions at that time. And then we'll come back very briefly for some brief roundup and next steps. We will be sharing notes from these meetings publicly, so those will also, and this is being recorded. I should say that this is being recorded, so you should know that, so that we can share that with people who weren't able to attend today, and also to make sure we capture all of the suggestions that come up today. So extreme heat, as many people know on this, is the leading weather-related killer in the United States. It is often called the silent killer because many of the heat-related injuries and deaths don't necessarily get accounted as heat-related. They could be someone faints and they don't record it as a heat, or someone dies of a heart attack and they don't record it as heat related. And so we have more recently become a greater awareness of the level of heat and its dangers, estimated at the levels of 12,000 a year of excess disease burden. So that's something that we need to look at. And of course, here in Miami, we have both high heat and humidity, and that can lead to heat-related illnesses, cramps, heat exhaustion, heat stroke. And there are certain groups that are more at risk: children, pregnant women, outside workers, low income people, homeless. So we need people on certain medications and other pre-existing conditions can be at higher risk, older adults. What we've learned through research is most of these heat-related illnesses and deaths are very much preventable. And there are many strategies for preventing heat-related illnesses and deaths. We're going to be addressing one of those today. We're going to be addressing others in subsequent workshops, but today it's really focusing on how do we get everyone, all our residents, but particularly those most vulnerable, the information they need to better prepare and respond to increasing heat. So what do we know? We've actually seen since 1970 about a 2.2, a little over 2 degrees Fahrenheit overall increase in our average high temperatures. And what does that result in? It may not seem like a lot, but since 1970, that means that we've gone from 84 days a year over 90 degrees to 134 today. So that's a lot, and that's where we start to get into some danger zones of dehydration, et cetera. And that's caused not only by climate change, but also by our development patterns here in Greater Miami, really in cities worldwide. The higher density buildings, pavement, less tree canopy, that can relate to surface temperatures up to 17 degrees hotter than, say, our Everglades or areas with very high tree canopy. And overall, our developed area is about 1.7 degrees hotter in the Fahrenheit than the rural areas. So we know those are elevated, and these temperatures, varying temperatures or urban heat islands, are very much aligned with our lower income neighborhoods. On the left, the white areas, the light blue shaded areas are lower income census blocks and the or census tracts, and the on the right is our tree canopy, with the white areas being the lowest tree canopy, less than 10%. It's recommended is 40%. We currently average 20% in the county, but you can see the disparities and how they align. Not exactly, but very closely with our lower income areas. And our future is going to only increase in terms of these high heat days. And as we all know, it's really the heat index, because the humidity makes it that much more difficult for us to regulate our temperatures. And we're going to be going from a historical average of about 7 days a year with the more dangerous 105 heat indexes or more to 88 days a year, which is close to 3 months. So we need to manage things differently. But really, even a heat index at 90 or above can be dangerous to outdoor workers if they're exposed in an extended period of time and not have access to water and shade. Certainly at above 100, we start to see our more vulnerable populations at risk. And above 105, really everyone is at risk for any exposed period of time. So why is education and outreach important? Really, we're aiming for two things. Certainly, first and foremost, to help our residents and visitors make informed decisions to protect themselves and those around them. And secondly, to increase public awareness and support for some of our heat risk reduction efforts and policies. If people don't understand the risks, if they don't understand the challenges that our population is facing related to extreme heat, they're less likely to prioritize those actions and policies in the public sphere. So it's important that everyone understands the need. So we want to inform on facts, educate people about their appropriate response, and really elevate that perception and reaction to the level of how we do it here for preparation of hurricanes. And we can't do it without our partners. And I put this list together with the risk of, I know I'm not including everybody, but these are people we've already been talking to about heat risk related interventions and have been part of our idea generation so far. We welcome more under this tent and need more under this tent. And that's one of the things that we're going to be teasing out today. But really, this is all hands on deck effort, and we'll need coordination between our national partners of the NOAA National Weather Service and our state partners at the Florida Department of Health, our local jurisdictions, our universities, our nonprofits, our public sector, our healthcare sector. So I mentioned earlier, there are certain populations that are more vulnerable: older adults, infants and children, people with particularly lung and heart conditions. Pregnant women can be have a harder time regulating heat and also result in negative birth outcomes. Low income, both because it's harder for them to afford and keep the AC on, may have limited access to AC, could be homeless and be more exposed. And I would say athletes playing outside and people just generally recreating outside is also could be tourists partying, but those are some of the areas that are more vulnerable. And then outdoor workers, which we have a lot. We have over 300,000 outdoor workers here in Miami-Dade County, the largest in the state. One of the things that we've learned, and I'm sure you just know this intuitively, but it's so important to have consistent messaging, consistent sort of color and icons that people can recognize, and style that we need to do. So we want to educate those different vulnerable populations differently. How you reach an older adult and the kind of messaging you use for them is going to be different than for an outdoor worker. And we're going to talk about that today, both how you reach them and the actual messages. But it's important that we also have some standard communication tools so that people recognize it. And there's some unique barriers. I'm not going to go through every more vulnerable population, but just to give a sense of how things are different. There was a study that New York City did on extreme heat awareness amongst older adults. And what they found is that while older adults tended to understand that elderly are more vulnerable, they didn't see themselves in that category. And approaching elderly myself, I can understand. I don't really think I'm at risk, but and I see that in my parents too, that they don't see themselves as having the same risks as their peers. And then caregivers not really associating heat-related illness indoors, but only outdoors, and not fully understanding how medications can impact elderly's or older adults' ability to regulate heat. And certainly many older adults are on different medications. The communication ideas were about motivating them for protective behaviors and emphasizing that extreme heat can be deadly, and that indoor environments. And New York's a little different than Miami, and that's some of the things we're going to get into today. But still some great things to glean and learn from that. This image is from our Heat Health Toolkit that was created by with a lot of help from our intern the county had, our Office of Resilience had last summer. And then with the Office of Resilience in Miami-Dade County, and I pulled it together. And so these are different tools that are in our toolbox. Today, I want to be talking about some of the ones that are suggested in here: the partnering with schools, heat health public service announcements, creating neighborhood ambassador program. We're going to be enhancing our citizen emergency response teams, training and outreach, and we can talk about that more, but want to use them as buddies, but other ideas around that. And certainly engagement through some of the things we're doing here today is building, developing, and maintaining our networks and establishing private partnerships. This past summer, we did some increasing messaging in partnership with the Armstrong Resilience Center through social media here and in other cities. We also partnered with them on a resilience pod to bring to different large public events to help educate people about climate resilience more broadly, and created some different posters for all our public sites at parks and libraries in different languages, and partnered with our National Weather Service and NOAA to increase the messaging they were putting out related to our daily hazard reports. And finally, in our summer camps, we did a lesson plan that at different ages really helped kids think about how they were experiencing heat, not only in camp, but at home, and what they did to protect themselves. Some of the things we've learned from NOAA around best practices for risk communication and behavior include certainly making sure your plan is informed by science. We want to speak to our audience's interests, not our own. So we really want to be aware of what those are and explain what the risks are, offer solutions to reduce those risks, and work with trusted sources in the public. Dr. Cheryl Holder often talks about how our healthcare practitioners, particularly nurses, are some of the most trusted sources of information in our society. Who are those trusted sources for each of the populations that we're trying to reach? And we want to test those messages before we do a big widespread message campaign with billboards and bus wraps, et cetera. We want to make sure those messages resonate. So need your help in thinking how to do that in a cost-effective and efficient way. And we want to certainly use multiple channels. People get information more and more from diverse sources. From the Environmental Protection Agency, they have a guidebook on how to message and do public awareness around excessive heat events. Now, in Miami, it's a little different because we have excessive heat events almost every day, or it's not excessive, but it's just hot. And so we're going to need to think about that. But it is important to have a formal system for excessive heat events, and to make sure those messaging covers what is the weather forecast exactly, what can we expect from the weather forecast, what are some of the symptoms of what people may be able to do in response to that risk, and to protect themselves against what some of those symptoms are, and what are some of the risk factors that people should look out for, both in terms of who the people are or their conditions that they're in. And there are some great graphics already available through NOAA about when does a heat index become more and more of a danger, about how to notice the signs of heat exhaustion or heat stroke, and what you can do, that I think we can borrow from and use, because the more we're consistent nationally too, Miami is a place full of visitors from all over, we can reach more people. So we want to, this is an image of Dr. Cheryl Holder at the launch of my role and the announcement that we would put together this task force. But we want to, and that was April 30th last year. This year, we want to, around the same time, roll out a heat season campaign on the level of hurricane awareness, and do a big one media day around providing the information, explaining the heat health impacts, and then we need to think about how do we maintain that media interest during those higher temperature months to keep it in the public eye. Through schools can be a very effective way, particularly reaching more vulnerable populations, and certainly getting the message back to home. And again, through particular populations, through our healthcare practitioners, through our emergency management personnel and first responders, outdoor workers, caretakers of older adults, through pregnant women, and those with mental and physical disabilities, and how do we also reach those who are recreating outside both either for sports or for partying, which do end up being a big source of some of our local heat-related injuries. So we want something that's on the level of hurricane preparedness and education. Do one big public communication event, have targeted communications for priority audiences, but yet make sure we have consistent messaging through all. So what we're going to do is now break out into groups. And I guess before we do that, I should see if there are any quick questions that for clarification that people want. But we're going to break out into 4 groups. We have facilitators and note takers in each of those groups. And we're going to get your input. You're going to introduce yourselves and then get your input on what you've seen out there is a really effective public outreach campaign or technique or something that you saw that just you felt was effective. And then in particular, your thoughts on the best ways to reach some of our more vulnerable populations, either the messaging they need or who might be the best messengers or partners to help us reach them. And then finally, how do we test our messaging to be more cost-effective and efficient before we do a large-scale deployment? And then finally, the last question, it's not listed here, but really any other partners that we should be considering, sources of resources before we, that we hadn't spoken about in your group before. And I see Myra Cruz has her hand up, so I want to give her the floor for a question.
Thanks, Jane. This is all great. I guess both of my questions are kind of related. The first is, can we amend the list to also include outdoor workers or those that are working in like heat exposed industries?
Great question. So we actually have a full public workshop dedicated to outdoor workers later on. So I didn't want to spend a lot of time today on it because we're dedicating a full workshop on that. Okay, perfect. And then the other sort of related question, just for those of us interested in this, how did you get at that 300,000 outdoor workers number? Is that something that you're readily able to find? Yeah, so the I think it was the Union of Concerned Scientists who came out with that report. I'll get you the link that showed those report that information, but I'll get you that link. I think it was the union that got that, and it was 318,000 outdoor workers. Perfect, thank you. Any other questions before we go into breakout groups? I think I see any. Okay, so Chelsea, take us away to our breakout groups. Hi all. If you were like our breakout group, you got cut off mid-sentence because there's so much to get through, and I'm sure it was hard for all of you to get through the full list of things today, but I know that we just got an incredible amount of resources. I'm going to ask each of the facilitators to take a minute and just share or two of some of the things, but I'll lead. Just got great information on some really effective campaigns from everything from in California related to the increasing wildfires and use of smartphones and buddy systems, particularly in low-income communities like in Bangladesh. The effectiveness of communication. I see Sherry's lifeguard stand, but of the flags that they share out there about the sea conditions, people recognize that. How do we use that? And are using our different resources of CERT teams and Miami-Dade Corps and the Community Emergency Response Team and tenant council. So we got we got so much information. I don't want to get into it in detail. We will share it back out. Just want to hear maybe from one of the other facilitators. I see Nicole there, so why don't I call on you?
Thanks, Jane. Yeah, we had great input. Do you want me to go question by question, just a couple?
No, I mean, just whatever, however you want to summarize it, because we don't have a lot of time.
Yeah,
a couple minutes.
So we have great ideas, you know, as far as like getting the word out. Some of the things you mentioned, folks talked about colorful flags, something similar to the hurricane brochures, and making sure that whatever we do is multilingual, and taking advantage of the tourists and using the ports, for example, as a venue. Working with our schools, our universities, our health system to connect with those different groups that, you know, we're really trying to make sure that we reach, even making sure to utilize our not-for-profits and our churches to reach some of those folks that, you know, maybe we don't normally reach as readily. Looking at connecting, utilizing some of our big brands like the Miami Heat, for example. Maybe they're willing to partner and, you know, sponsor something. FPL came up quite a bit. Folks think that FPL really should be a part of the solution as well, not only with support and advertising, but also maybe helping folks who need help and don't have enough money for AC. Maybe FPL or businesses can sponsor some of these families. So those were some of the great ideas. And I wanted to mention, Jane, one of the questions was, you know, our folks are really engaged. They want to know how they can help. What are the next steps going forward? How, you know, how can they help us do all of this? So I told them to certainly continue to be a part of these meetings, and to stay tuned, because we would be providing those next steps, and that we always need help in partnering and getting the word out and connecting with folks and organizations. So told them, you know, stay tuned and be a part of this.
Yeah, and certainly there will be other workshops coming up, the next one being January 11th on data and research. But if you have follow-up ideas and suggestions, please email them to resilience@miamifoundation.org, resilience@miamifoundation.org. We will be gathering those. And Galen, do you have anything you want to share from your group?
Yeah, so we have a great group. There are a lot of ideas. They said that focus groups would probably be really good. And there was a lot of discussion of building on things we're already doing. So things that are working at the county, ways that we're already, when we talked about specific groups, they said, well, this organization already is talking to them, or they're already there, there's food being delivered. But I also think one of the other themes that I was hearing was engaging with people at multiple levels. So not just social media, but in person, and where they are, you know. In terms of measuring what might work, one of the things that I think is interesting is an idea to do a short survey that could be forwarded to organizations to say, how interested would you be in collaborating on heat? I think that's an interesting idea.
And I like that we heard a lot about building on existing initiatives through our city and county emergency management offices, our city and county parks, through certainly our healthcare network, the housing, resident councils, different. So I think that building on some of those networks and resources that we have makes a huge amount of sense.
Yeah, and our universities have some skill in doing focus groups and marketing type research. They have marketing students and professors that may help.
Great. Yeah, I love that. Sandra.
Yeah, thank you. We had so many experts in our group, and Nicole, it sounds like our group had a lot of sort of parallel ideas to yours. One idea that really stood out to me was working with FPL when they send out the power outage notices to also in that message include messaging about heat safety and health. We had a lot of physicians in our group, so we talked a lot about healthcare providers and how to utilize our healthcare networks to disseminate that information, and how to reach out to those groups and make materials that are easy for them to distribute and get out in multiple communities, multiple populations and languages. And we also had a fun idea to do a TikTok campaign, maybe partnering with the Miami Heat dancers for younger populations to do like a TikTok dance about extreme heat and safety. So I thought that was a really fun idea. And so many more. So yeah, really great discussion.
I look forward to reading all of it. This has been so rich, and I know I'm going to get so many more, but by reading all the notes and re-listening to the recording today, I can't thank everyone enough for participating. What an amazing group. We just have diverse experience and resources and expertise. Please continue that input through resilience@miamifoundation.org. We do have also at the Miami Foundation Extreme Heat website, you can sign up for future workshops. And we're hoping to get a draft together of our 2022 heat season campaign by the end of January. So if you wanna see anything along that line, please share. And I wish you all a great day, and we'll be in touch. So I like to end on time or early. Be well.
Thanks everyone. Thanks, Jane.
You.
Thank you.
Everyone.
Thank you.
Have a great day.
Thanks. Have a good day.
Happy holidays. Bye.
Bye. Happy holidays.